Hi, this is Dr. Morrissey with the Morrissey Institute, bringing you another video on EMDR. So if you were a prospective EMDR client and you were trying to figure out a therapist to go to, there's some questions that are very important for you to ask and interview your therapist. Just because they say they're trained or just because they say they're certified doesn't mean that they've used it a lot, that their success rates are high, or that they're following the protocol the way Francine put it. So it's your job to interview somebody and ask those questions. Some of these questions are not just how long have you been trained, because you could be trained 10 years. How often have you used EMDR? How often do you use EMDR? If you see 30 clients a week, how many times a week are you using it? That'll give you a really good idea, because you could have the skill, but you could be very rusty if you're not using it frequently enough. So find those things out. Ask them what their success rates are. Not for them personally, but what are the success rates of your clients who come in for treatment? If they're not keeping track of their success rates, that's okay. Not everybody's like a stat nerd like I am. I've kept statistics of that for many years. Okay. But it's like, okay, so if you're treating somebody with a single incident trauma, how many sessions would you expect that would take? If you're treating somebody with complex trauma, how many sessions might you expect that to take? How much improvement would you expect to see with my depression, my anxiety, my hard time falling asleep, right? So asking some deeper questions to figure those things out. Another question to ask them is, what is your philosophy on EMDR, or how were you trained? Some people were trained to jump in at the worst thing possible and treat that and work their way down. Now, I know that got misconstrued somewhere along the lines, because in Francine's book, even the 3rd edition, on the right-hand side, there is a paragraph that says, if you are newly trained to EMDR, you should not do EMDR at a SUD, subjective unit of disturbance level, above a 5 until you are confident and comfortable with doing EMDR. So they should technically be starting on the lower or smaller T traumas, teasing, bullying, phobias, minor car accidents, moving around, test anxiety, public speaking, stuff like that first, and peeling away the layers so the therapist is more comfortable with EMDR and confident in it, and you as the client have some layers peeled away so you build confidence in the process, and you're not waiting 6 months for the therapist to feel like you've built this therapeutic rapport with them in order to jump into the worst thing possible. So if I were going to a doctor and I had an issue and they told me it would take 6 months because I don't know them well enough and they needed to get to know me and my body better before they could decide on starting the treatment, I'd be finding a new doctor. So when I look at EMDR, my philosophy is the same way, is that I am going to jump into EMDR. And I'm confident in my skills because I use EMDR out of 8 clients a day, anywhere from 4 to 8 times a day. And I've been doing that for the past dozen years. So I've got many hours of experience under my belt. But when I jump in, it's like you do your assessment, determine the diagnoses for the insurance, and then I do the treatment plan. By that 3rd session, I'm already starting phase 1 history taking of EMDR. And by the next session or 2 sessions after that, we are starting phase 2 of EMDR or phase 3, because I start low and work my way up. The example I give people is, great, I've climbed 14ers here in Colorado, right? So what I've learned is that when you climb a 14,000 foot peak is you do switchbacks. And on those switchbacks, your body is adjusting to the higher elevation, the lack of oxygen, your muscles with the climbing as you go. If you try to go straight up, it's going to be so hard on you, your body's not going to adapt or adjust to it. So that's a part of my philosophy. The other part is, once we get to the top of the 14,000 foot mountain, we are going to parachute off of that. And you're like, I don't know you. I'm not jumping off of a mountain with you. Why? Because you don't know if I know what I'm talking about. Did I pack the parachute right? Because if the parachute doesn't open, I'm going to die, right? So all of these things have to do with trust. But if along the way, we are peeling the smaller layers away, like switchbacks climbing up, you are getting adjusted to it. You're building your confidence in EMDR and the small things. You're seeing the improvements. These are your capabilities. Now, instead of the 14,000 foot peak being here, if we've chopped off everything, then it is now here and there's no need to jump off this big cliff. So by the time we get to those big T traumas, the 9s and 10s on that scale, yes, it's still a little scary, but it's not horrifying. Okay, so that would be another question to ask. Are you certified? That might be a question if that is something your insurance requires. Most of the time they don't. What are you specializing in? How many hours have you spent specializing in that? If you're going to somebody for pain or addiction, then you want to know that the majority of their time has been using EMDR treating these things, okay? So just some of the questions. I have more questions listed on my website to help you find the therapist that's right for you and to know what to ask. Because again, like I've said in other videos, you are paying somebody for a service, right? So you want to know that you're going to get a good service from this. And if you're not, and I've had many clients tell me this, they're really nice. Well, yay, I'm glad they're really nice. If you're not getting what you need from them, don't be afraid to seek out another EMDR therapist. Whether you ask for a referral, you get on the EMDRIA website or the EMDR Institute website, you go to find a therapist, put in a zip code, put in your specialties or check the insurance boxes, and then start calling people and asking them some questions. You'll be able to find somebody else. I hope this helps you in finding the treatment that you need from a therapist you will feel comfortable with, and good luck in your healing journey. Stay tuned for another video.